The professor of psychiatry at Wells Cornell Medical College, Richard Friedman, talking about ADHD. From his writings, did you gain that make you look at the situation maybe a little better or can modify your thinking a little bit?
Well, this article was in the New York Times just very recently in the end of October this year, 2014. And for me, I'm now recommending it to all my patients who have any children who take ADHD medications or kids that have ADHD symptoms. It's really, to me, is a wonderful article. This has been my clinical experience. This is exactly what the doctor's describing there. The kids that get labeled ADHD, they are very quickly bored. It seems, and he traces through the chemical circuits of the brain, that they have, there are actually studies that show that their reward centers are less stimulated than in equal situations to, say, other kids who don't have ADHD. And so these kids are constantly seeking stimulation. And I've noticed this myself. So, we call it hyperactivity and we call it poor attention span. But really, I've seen it myself where the kids just need to be occupied. And that's why most of the kids that I work with, their symptoms seem to go away in the summer when they go to a summer camp. All day long they're playing, they're active, they're doing things, they're breathing in fresh air, they're swimming. Then the school year hits, and we give them all this homework, and they're cooped in a house. Of course, we know it's also dark and colder outside, and they're inside. And now they have nowhere to get their stimulation, so they start creating it themselves. The greatest line that the parents give me, I shouldn't say the greatest, but the most common, is that he seeks negative attention. And it's become kind of a standard thing. Everyone accepts that idea that, he wants negative attention. And I've always had a problem with that. Well, there's ways of getting positive attention. Why is he specifically seeking negative attention? The implication is he's a bad kid. They're seeking attention, stimulation. And that's what this article so much talks about, that perhaps less use of medication and trying to stimulate these kids. And so I just had a conference recently with a teacher, and this is before I even read the article, and I said about the boy that she was describing, I said, keep him occupied, give him tasks, water the plants, clean the windowsill, do this, do that, because...
That's why oppositional defiant disorder and ADHD is sort of like very common together?
Yes. They co-occur about... They say about 60, 70, 80% of boys who have ADHD also have oppositional defiant disorder. They say about 50% of girls, maybe even a little less, like a third of them. So, again, these kids, quote, they're acting out supposedly for attention. They're acting out because, quote, they have bad behaviors. But I've always been very skeptical about that. My sense is that a kid loves attention. All kids love attention. So give them attention, create attention.
This psychiatrist bringing to the point that even some of the medicines which affect the dopamine, you have to be very careful in this balance too?
Oh, yes. They affect the dopamine and the neurotransmitters, and this is all reasons why we should be looking for alternatives to give. And in fact, he calls it, I believe, something using natural ways to treat ADHD.